Welcome to the demonstration of the A1C Now Plus multi-test A1C system. With results in about 5 minutes at point of care with 5 microliters of blood, the A1C Now Plus provides you with lab-accurate results. The A1C Now Plus system consists of 3 main components: a monitor, a sample dilution kit pouch that includes a sampler and a blood collector, as well as a test cartridge pouch including a test cartridge. Note that the cartridge pouch should not be opened until you're instructed to do so. We provide you with instructional materials. To complete this test successfully, it's important that you review these instructions and follow all steps. You should perform the test at room temperature, meaning 64 to 82 degrees Fahrenheit or 18 to 28 degrees Celsius, and avoid direct sunlight. If the kit has recently been at high temperatures above 82 degrees Fahrenheit, or in the refrigerator, keep the kit at room temperature for at least 1 hour before use. A1C Now Plus kit may be stored refrigerated up to the expiration date or at room temperature for up to 4 months. Quality control materials are recommended to be used to confirm the proper operation of the test. Refer to the Professional Procedure Guide for information on when to run controls. Drawing blood. After you have reviewed all the instructions, identify the 3 main components and make sure that the lot numbers match. The lot numbers on the monitor, the shaker pouch, and the cartridge pouch should all match. Open the sample dilution kit pouch and remove the sampler and the blood collector. Before testing, ask the patient to wash their hands with soap and water or use an alcohol wipe to cleanse. Be sure the area is completely dry before lancing. Lance finger, drawing an adequate blood sample. Note that if using a venous blood sample, only heparin, lithium or sodium serology tubes should be used. Collect the blood using the blood collector. Touch the blood drop with the tip of the blood collector and the blood will automatically be drawn into the blood collector. Make sure the blood collector is correctly filled. It must be filled to the line. If there is excess blood on the collector, you should wipe it off gently with gauze. Make sure that there is enough blood left after wiping. If there is not enough blood, gently stroke the hand and finger toward the puncture site for some extra blood and draw it into the blood collector. Adding blood to shaker. The base should still be on the shaker at this point. This will help ensure that you insert the blood collector into the open end of the shaker. Insert the blood collector into the open end of the shaker. Push while twisting and make sure that the blood collector is inserted all the way. There should be no gap. Shake the shaker vigorously 6 to 8 times. This will mix the blood sample with the test solution. Set the shaker down on the table and now start preparing the cartridge. Inserting the cartridge. The cartridge pouch should remain unopened up until this point. Now, open the cartridge pouch and remove the cartridge. Ensure that the code number on the cartridge matches the number on the monitor. Insert the cartridge into the monitor. It should click into place. The monitor will run through an internal self-test and display weight. Wait a few seconds for the monitor to display SMPL, which stands for sample, before proceeding. SMPL and the flashing blood drop indicate that it is now time to deliver the blood sample. Adding blood sample. Pick up the shaker and remove the base, exposing the plunger. Deliver the blood sample into the cartridge by pressing the plunger into the test area of the monitor and remove immediately. Run will appear on the display. This should be done gently and quickly. This will deliver your blood sample into the monitor. Results. After the sample is delivered, the 5-minute countdown will begin. Do not pick up the monitor while you wait. After 5 minutes, the monitor will display QCOK, which means the test passed quality control, and your A1C result will soon be displayed on the monitor screen. The test is now complete. The monitor will also show how many tests are left in the kit. Please note that the monitor will not store your test result and will turn off automatically 1 hour after being used. Some key reminders. The following are some of the key points you need to remember when using the A1C Now Plus system. It may be helpful to follow along the professional procedure guide while performing the actual test. It's important to draw the correct amount of blood into the blood collector. Make sure that the blood fills all the way. Also, make sure that there is no excess blood. Do not remove the base of the shaker before you are instructed to do so. This will ensure that you insert the blood collector into the correct end of the shaker. When inserting the blood collector into the shaker, push while twisting and make sure that the blood collector is inserted all the way. There should be no gap between the pieces. It is important that you remember to shake the shaker vigorously 6 to 8 times. When delivering the sample into the cartridge, remember to press down gently and remove as soon as the plunger pushes into the shaker. Run will appear immediately. Do not keep pushing. This video is also available to watch at any time on our website, a1cnow.com. Thank you for using the A1C Now Plus system.